Well, good evening, everybody, and thank you for joining us tonight for this webinar on succession planning for general practice and allied health. I'm Sandy Vincent from the PHN Education team, and I'm joined tonight by my colleague Amy Clyde-Smith, who has coordinated the session, and our two wonderful presenters, Russell Lee, who's the founding director of the Health Business Network and Docio Health, who'll be speaking on succession planning with a focus on the rural setting, and Jason Borody, Director of Vividis Marketing and Co-founder Director of Docian Health. Before we begin, I would like to acknowledge the traditional custodians of the land on which we all work and live. For me, that is Darkinjung land, and pay respects to elders past, present, and emerging. I've got a couple of things I need to let you know. This session is being recorded, and the recording will be available on the PHN Education Library in a couple of days' time. At the moment, as attendees, your cameras and microphones are automatically disabled. If you do have questions during the presentation, please send those through the questions box, which you'll find in your control panel. If you can't see that control panel at the moment, you might need to click on a little orange arrow that will open that up, and then you'll be able to see the questions tab where you can type your questions. We've got time at the end for us to address those with you. An evaluation will come to you directly after the session. Please do complete it, as your feedback is very important to us. It's now my great pleasure to introduce our speakers to you. Jason Borody is a business consultant and marketing manager with over 26 years of commercial and leadership experience. Jason has a Bachelor of Business majoring in finance and marketing and a broad range of experience both in Europe and Australia, specializing in business development and strategic marketing for medical businesses. He's worked with brands like Medtronic, Private Practice, MedTech Global, as well as hospitals, practices, and colleges. Russell Lee is a clinician, business consultant, educator, and facilitator who has guided hundreds of doctors and medical practices to profitability and through to successful sale of medical practices. Russell and his national team at Health Business Network design agile business solutions for healthcare providers of all sizes. Russell also co-founded Open Heart International, which has provided thousands of life-saving surgeries in 13 countries. And in 2012, he was awarded the Order of Australia for distinguished service to the international community and his expertise in establishing a clinical outreach service that provides insight into successful and scalable medical and allied health operations. So you're in very good hands tonight, folks. With that, I would actually ask Jason to please start your presentation.
Well, I'd really like to thank Sandy and Amy for inviting us to present to you all tonight. This slide that's up there at the moment is a general disclaimer. I think that the information we will give you or share with you tonight has the best intent. However, we always have to remember that when we're doing something, we need to have specific advice for our own practices. So just a reminder on that. Sandy has been very kind and shared about us. So we'll get straight into the discussion, and we're going to start off by presenting some information to you, and then later talking and trying to tease it out a little bit more and answering some of the questions. And when we're talking about succession planning, probably the first thing is who buys into healthcare practices and why. And the typical buyers, if we look historically, come from inside a practice. So a doctor that's working in a practice might buy it off an owner who's retiring, or we've got external doctors that are developing businesses and they buy multiple sites. Then we've got young doctors that are starting out and looking to set up their business. And then, you know, obviously established doctors that are wanting to grow larger businesses. In the last probably 5 years, there's some groups that we call aggregators that get health providers from all around the country, and they buy a share in the businesses and have, you know, in one particular case that I am aware of, they have 57% of ophthalmology on the east coast of Australia. And so the doctors who own it still maintain a share in it with an opportunity to sell out at a future time. But with having such a large group, their buying powers are much better. They have able to reduce the overheads. And then, of course, there's the corporates. And today, we're going to tease that out a little bit more. And I'm just going to hand over to Jason to maybe talk a little bit about thinking outside the square.
I'll need to unmute to do that. Sorry about that. Yeah, look, I guess part of what we really want to do in this session, as Russell said, is really start to think about, okay, so what are some of the other methods that we can use to maybe find the resources that you need to be able to run a medical practice, and more specifically, someone who can come in as a successor, whatever that might look like. And part of that thinking outside the square actually comes down to considering where the value in a practice might come, and how we might make a practice attractive to somebody else to actually come in and either join with you or buy the practice out, or whatever that might look like. And there's a few different elements of that we just want to go through today, this evening.
So I suppose the next question is, how do you value a practice? And look, there are multiple ways of doing it, but when we're buying a medical practice or any type of business, even a coffee shop, what we're really doing is buying future revenue. And the level of security of that revenue continuing to go or to come in probably increases the value. And so there's the tangible value side of it that we need to look at, and that's the numbers, the assets, you know, all the equipment that might be in it, whether there's a good workflow, the practice looks good, all those type of things. The revenue stream is reproducible, and in healthcare, so long as we're providing good quality care, it's reasonably simple for that revenue to be maintained, even if there's a change of a doctor or a healthcare provider. So we definitely have to look at the tangible value of it. But Jason's going to talk about another part of it that I often think is what really attracts a person to whether they actually are seriously interested in it. Really, the tangible value is, it works out whether we're going to pay the right amount of money for it. But what's going to attract it is what Jason's going to talk to you about.
And if you've ever sold a house, for example, you'll know that you can often get a better price if you tart it up a little bit for sale. You know, it might need a fresh coat of paint, or you might want to redo the gardens, or those sorts of things. And I guess when it comes to succession planning, getting partners into practices or selling practices, a lot of those intangible values actually make a really big difference. As Russell was saying, the tangible determines what the deal should be, but often it's the intangible that actually is the thing that determines whether someone will A, come and is interested, and B, whether the deal actually goes ahead. And so, you know, these are things like looking at other elements of the practice, looking at the patients that you have, the regularity of patients, the type of case mix or patient mix, looking at any other IP that the practice might have, looking at the actual practice itself as a brand. And obviously goodwill is a big part of this, and that probably bridges the gap a little bit between intangible and tangible. My father was a medical specialist who died way too young, and it was down to my mother and myself to find out what to do with his, to wind up his practice, and essentially we ended up selling it. But the big question there was, for the incoming specialist, was, how do I know that the patients that your father had built up in his practice will continue with me? And that all comes down to the goodwill factor. So these are some of the areas that we just want to, I guess, explore a little bit more and look at ways that you can use some of these things to help plan for your succession, and also help actually implement something that's going to be valuable for your practice and for your future lifestyle, but also for the community and your patients as well. So I guess where this really flows onto naturally, this is how you value a medical practice. So what actually sells a medical practice, Russell?
Look, the big thing that I think we need to also remember in looking at selling a medical practice, in a rural setting like most of you are, there's probably not the competition and not the other practices around that will create competition. So I actually think that what we've got to think about, and we'll talk more about tonight, is the intangible assets that Jason has alluded to. It's the aroma of the baking bread, in the house when people walk into the house, as to gets the emotion thinking. And in a rural practice, we've got to start thinking about outside the square about how to do that. Now, when we're selling a practice, we do look at the numbers, how much we're billing per year, how many patients we're seeing, what are the conditions in the area, is there competition or no competition, what's the size of the practice, and how many full-time equivalent doctors. And in lots of rural settings, there's one or two. And what we found is today, and we'll talk a bit more about this later, is that the younger generation of practitioner doesn't want to work 80 to 120 hours a week. They want to work part-time and have a better lifestyle than all of us baby boomers who work, crazy hours. So having multiple doctors that will share the load and reduce the overheads is really, really important. And then the asset, the physical layout of the business and what it's got to offer, the systems and processes. If a practice is able to run on its own without the doctor being there or the owner being there, that's even more attractive. And so I think there's some of the tangible values that we need to look at, is are they in good shape that would allow somebody to look at it, so that the intangible values which might make them buy the practice is going to work.
And I mean, as Russell alluded to, competitive positioning is, I guess, what we've got, one of the points on the intangible value side. And I mean, it depends where you are. I mean, we've worked with, I would say, sort of fringe metro or fringe rural practices where, there are sort of arguably too many doctors in an area. So, I mean, that's something that comes into play. But also, the reputation of the practice and how it presents and how it's known, what it's known for, whether patients are going to stick around, or whether if a new doctor sets up in town, whether they're going to steal a large proportion of the patients. So that all comes into play, and also how reliable is the patient base? Do we need to be trying to get new patients? Again, it depends on where you are to some extent. If you're a specialist practice, we obviously need to be thinking about the referral database as well, and whether patients will go to metro areas for procedures, or whether there are the facilities regionally to be able to do that. So there are a number of these sort of intangible values, but I guess those last three are probably three really important ones. The loyalty of the patient base, and if you're a specialist, referrers, obviously, or allied health, referrers are important, but also the loyalty of the team that you have as well, and depending on how large that is, and also just, I guess, the culture and the values and the vision, I guess, of the practice and where it's going can actually be very important. And to all of these points that are up on the screen at the moment, the thing that really, I guess, makes the biggest difference is you need to know what you're doing with your succession plan. You need to have that plan in place. So I think that's really something that Russell can take us through.
Just before we go, Jason, the point that you made about having a plan, I think is really, really important. When we start helping doctors set up a practice now, we're often asking them, what's it going to look like in 25 and 30 years time, right? And that's starting to build from before they've even started to run or set up their practice. What's the succession plan? Now, for those of you who've been in business, so long as you've got 3 to 5 years before you're choosing to retire, I think you've got time if you put a plan in place. So how do we prepare for succession? And I think that just like when we're actually diagnosing a patient, you know, we actually assess or test to come up with a diagnosis, and then we actually have treatment. Well, the same is when we're actually working with you to help you set up a practice or to prepare it for succession, is we need to do some research about what is the practice, what are the foundations, what are the good things, what are the not so good things, what do we need to improve, what's going to make it attractive to some people. And you know, I think the big thing is that if you've been out there in the rural setting for quite some time and you haven't been able to attract a doctor to work with you or another practitioner to work with you, it means that you've got to think outside the square and do something different. And so what we find is if you do the research and have some external people help you do that, you then can start looking at some of the strategy that's required to actually develop the plan and formalize it and then put it into play. So it's no different to you practicing medicine or physiotherapy or what have you. We're just looking at it from a business sense and taking the information that we understand. So, you know, in research, we look at the financials, we look at the patient numbers, the case mix, what type of patients are they? Is this a blue collar or white collar area? Is it an area that, you know, can afford to pay and have a mixed billing practice? Or is it an area where, you know, it's a lower socioeconomic level and people are struggling and we need to look at, you know, bulk billing, you know? Understanding all of that helps you start to look at where you could go with it. And I think that developing the strategy, whether you're starting off in practice or whether you're growing a practice or whether you're succession planning, taking that information and developing a formal plan, you know, with goals that help you position the practice, that sends a message out there that, you know, things are changing and you're going to attract people. Understanding what your competition is. You know, I can remember when I left the hospital setting and went into my first practice, I can tell you it was December 1994. I can tell you exactly how many patients we saw in the first week, the average dollar per patient, and I can tell you what it was 7 years later when we sold the business. And what we tended to do, because we had done the research, we had a plan, we then constantly, through our activity, referred back and measured what we were doing and then tweaked things as we needed and moved on to work towards fulfilling our goal. How do we find the right people? You know, I think that you know, in our practices today, we already have a certain number of staff, and I think that what we've got to think about, and at the moment it's really hard, no matter whether you live in the rural area or whether you live in the city, COVID has had a significant impact on people moving and changing their life, changing what they're doing. And so we're finding it even harder to attract receptionists, to find nurses, to find doctors. But those practices that have got something different, have got a culture that have the ability to share what it's going to be like to work in their practice, find that there's so much easier to attract people and to have people make a decision to join them. You know, I recently went and visited one of the practices in your area, and one of the things, they had a GP registrar working there, and he potentially was leaving at the end of the 6-month period that he was there. And we asked him whether he'd considered doing some telehealth from when he's back in Sydney. And because he already knew some of the patients, he could do a few sessions a week as telehealth. And, you know, the eyes lit up and, you know, it was a positive. So I think we've really got to start to look at what is going to attract people to work in our environment that we live, whether it's a city, whether it's a rural area. And look, I have to say, I have in the last 15 years spent some time working in central Queensland, from Gladstone and Rockhampton, Billawheeler out to Emerald, and helping practices look at this. And it's really been fascinating when we've yes, found out what the practice is like, but then worked on a plan to attract the right people. And it actually was not only having a vision for what we wanted to do, but finding out what the community could offer. And we'll talk more about that a little bit later.
And I think this is a big issue at the moment, not just from a succession, well, obviously from a succession point of view, but as Russell, you were saying, even just from a staffing point of view. And I think this is where actually spending some time about thinking how you can make the practice more attractive, and also thinking outside the square about how can we actually provide healthcare services in our local community that are maybe a little bit different to some of the traditional models. That's one of there are a couple of the things that make a big difference to practices.
Yep.
And I guess that then leads us to the next point we wanted to talk about, and that was some of these different principles that are starting to emerge.
Happy for you to keep going if you want there.
Oh, no. This is all you, Russell.
All
I've got
right.
enough to say later on.
Right. Look, I think that the big thing that I found in providing healthcare, whether it's in the city, you know, where I've actually owned and operated practices, and in rural settings, but I've actually done quite a lot of work in developing countries. And, you know, sometimes you know, people don't have the facilities that we actually take for granted. And some of them become very, very creative in the way they provide services and what they do. And so I think it's really, really important to think, well, we might have been doing this way for 35 years. What are we going to be able to do to take us into the next century and provide care for our patients, and in a way that they can afford, and they're going to get the outcomes that we need. One of the things that I think that when we come up with the ideas and start to formalize it, it really starts to gain momentum, and we're able to actually start to achieve some things. And I think, can we just go on to the next slide, Jason? And one of the areas that I feel that has been an experience for me that I see not only happening, it happened years ago. Like, I went into my first GP practice in 1994, and we grew a multidisciplinary practice. So we started off with 3 doctors. We added a couple more doctors, and then we added some physios. We added some counsellors, eventually psychologists, and then some specialists. And we truly became a multidisciplinary practice. And the patients actually loved it because they were able to come, and it was nearly a one-stop shop. We added a pharmacy, we had pathology collection, you know, and there was, I even, because I was passionate about rehabilitation, I actually put a gym in the middle of the medical centre, and we had, at the out of hours time, we had a gym that the community came to, and in the office hours, we ran rehab programs for people who had stroke, and people who had high blood pressure, and people who needed to lose weight. And having this multidisciplinary team allowed us to achieve that. And so I just want you to have a think about what what could you do, and what are the other disciplines? And I'm going to give you a couple of examples. If we can go on to the next slide. In years gone by, basically there were solo doctors, you know, or solo practitioners, and we had administrative staff or clinical staff and nurses and overheads. And when doctors started to come together, instead of sharing those admin, they just shared the rent, and each doctor had their own staff, and there was no overhead saving at all. And the clever ones started to say, all right, let's actually have one lot of receptionists that cater for all the doctors. Let's have a real benefit in working together and sharing the overheads. And one of the things that I think I haven't tried it yet, but I thought about it the other day as I drove, 7 hours into rural Australia to think about is, could we get 3 or 4 practices in an area and have a co-op of practices that shared staff, and when holiday relief came, they covered each other rather than all being uniquely independent little practices. If we move on to the next slide, I want to give you an example of a structure that can work. And what we did was we started our practice in Sydney with 3 doctors, and we ended up with 27 doctors, 3 physiotherapists, a dentist, pathology, radiology, a pharmacy, and basically all of those people were sharing the overheads and the outcome, the collegiate nature that was there. And about 15 years ago, I was doing some work in Biloela, in Gladstone, and I saw that there were about 50 patients a week that were driving from Biloela to Gladstone. And I thought, what's going on in Biloela? So I hopped in the car and drove over there. And there was a wonderful doctor there called Richard Tan, who had been there for 36 years, and he was at retirement age and was thinking, do I close my doors? The other doctor who was in that town had closed his doors and moved away. And the community members, and we managed to get some funding and built a large medical practice that would house multiple doctors, allied health, pharmacy, everybody. And today they have 5 doctors there with allied health outside the square could actually give an outcome. And I've just got a couple of examples more that, yes, they're not GPs, but they are examples that could work. This is an example of a rural obstetrics and gynecology practice where there was an obstetrician who was 5 to 6 years away from retiring, who was thinking that they were going to have to close their doors. And so we sat down and we looked at their practice, and I said, well, do you have any midwives in town? Do you have any physios that work with you that you refer? And they said yes. And so I said, well, why don't we put together a model where they become co-owners with you or equity holders, and you all work out of one building, because you've got a really big building, but not utilizing it all. And we put the model together and then invited the midwives and the physios to come and have a look. And everybody was pretty excited. And so now there's an obstetrician, 2 midwives, 3 physios and a GP. And since probably 18 months after achieving that, we actually had another obstetrician come to town because of the environment and the team that had been put together. They were prepared to buy into the practice so that eventually the initial obstetrician could retire. So that's one example. And you might not have all of these people in your town, but I just feel that we've got to start thinking outside the square. This is an example of a neurology practice that we were working with, and we couldn't get enough neurologists to work with us, but we looked at all the subspecialties that we referred to, and we invited them to come and work with us. And so all of a sudden we actually have this practice that has all these different disciplines working together to meet the needs of one particular group of people.
So I guess really with this, I suppose we've been wanting to challenge you a little bit in terms of how you view your practice and how we start to think maybe a little bit differently, a little bit innovatively in terms of what's going to get people interested in your practice and coming into your area, into your practice, in getting involved. So I guess obviously planning, thinking through the structure and the function of how that's going to work and who can be involved is really important. And I guess that's really what we've focused on so far in this presentation. For the next few minutes, 10 minutes or so, I want to take you through, I guess, the other side of this that we've been talking about, and that is what are the factors that actually attract successors or attract partners to come in, and what can we start to think about and what can we implement and do to shift some of these dials. So I suppose as we've worked with people in this area, there are a few different, I guess, motivators, if you like, or influences, which seem to really have an impact in this space. So from a business point of view, often people are interested in having that autonomy. Like one reason for perhaps moving out to a regional area or joining another practice is because someone wants to have more autonomy in terms of their work life. Purpose and challenge, you can see the list on the screen there. You know, perhaps it's financial reward that they're chasing. Perhaps it's notoriety or legacy or reputation. You know, perhaps it's more personal type motivators that would be appealing to someone, whether it's lifestyle appeal, and that could be anything from that blue or green change to perhaps moving to an area where you know, maybe there's some opportunity for the hobbies that they enjoy, whether it's, you know, fishing or mountain biking or whatever it might be. It might be family reasons. You know, there are a whole bunch of things that actually motivate people to consider looking at shifting to another area or working in another area. And you can see those on the screen. I don't need to read through all of those, but as you can see, there's a lot of these different factors. And I guess the big question is, how do we tap into this? How do we actually get them to come? And I guess from my background in business development and marketing, for me, this is all about making it attractive. For me, it's all about building something that people can connect with and getting excited about. And for me, that comes back to branding. And brand is not just the logo. We're talking about every touch point that that, you know, people interact with a business or with a medical practice. And I guess, I mean, we need to think about what does a brand do? Like, why do corporations spend billions of dollars each year in developing their brands? It's because brands connect with people's values and with their personalities, and because ultimately what it does is it provides value in one sense or another. And I love this quote by Jeff Bezos from Amazon, where he says, "Your brand is what other people say about you when you're not in the room." And I want you to think on that for a minute in terms of, well, what do other people see when they see your practice? And I've just got a really quick little illustration here in terms of the value of brands, the value that brands can add. You know, if you look per litre at the cost of a few different items here, you've got home brand water, and I've done some calculations from a local supermarket here. You're looking at about $1.10 a litre. Petrol is in our area is currently running at about $2.20. I'm not sure about your area if it's a lot different. Branded water looking about $2.70 a litre, and then we see this jump to a brand like Coke where it's $3.65. Coke per litre is more than petrol, but that absolutely pales in insignificance with a brand like Red Bull, $11.30 a litre. And Red Bull's a really interesting case study because of how they've built their brand. It is all about connecting with people's interests and values and aspirations. I've got this really short 1-minute video, which I would love to share with you. If I can make this happen. Here we go. Let's see how we go. That hopefully you can hear me again. That whole concept of, if you believe in it, anything's possible, that whole concept of really getting the most out of life is something that Red Bull has been able to use to their advantage to really create their brand. So I guess the question is, what does your practice say about you? What does your brand say about you? Now, in a lot of cases, with the work that we've done, especially with rural practices which are heading towards sort of retirement age of you know, the main clinician or doctor there, often it's not great. And let's just go through a couple of examples that I've found on the internet just in the last couple of weeks. Have a look at a couple of these photos. This is for a practice not in your region, but certainly a rural practice. It looks pretty good to me, right? Russell, what are your thoughts so far? I think you're muted. I caught you unawares there. You weren't expecting that. Look, it's a practice that looks pretty good.
Yeah, it's a lot better than some I've seen.
Yeah, absolutely. I'd agree with that too, right? So now all of those photos that you just saw, I actually found on a business broker's website, a medical broker's website, and you can see the listing there. But none of those photos are actually on the practice website. None of, like, if you try to look at this practice other than one business broker's website, it does not look like that at all. This is their website. They've got 4 pages on their website, and these are 3 of them. You've got the home page on the left, their services page, and their practice information page is actually a PDF that just downloads to your computer. Like, if you look at this, if you're a potential successor, and this is one of the first interactions that you have, and we all know how important first impressions are. I mean, does this look like something you want to uproot your life for and move to another area? It's not all about looks, I know that, but just keep working with me here. Here's another example. This one is a little bit closer to home for you guys. This is another practice that I found on a brokerage site. I couldn't actually really find anything about this practice other than what was listed on the brokerage site. When I did Google searches, it barely came up. It doesn't have a website. You can see I've got the Google search screenshot in there. It does exist on Health Engine and a few directory sites, but there's really no information other than the contact details. So I just want you to think about how attractive is your practice. Here's an example of a practice, Grow Life Medical, where they've actually put some thought into this, and they've actually done a bit of work in this space. So you can see in the main menu at the top, we're looking at their Come Work With Us page. And if we look through the page, it's actually not bad. It's pretty good. And you look at this, it didn't take a lot of effort. There's a couple of photos that someone's taken in their practice. There's a little bit of information, but they've addressed some really important things. So first of all, they've given you a little bit of insight into the practice and who they are and what they're focused on, what the culture, I guess, or the personality of the practice is. And there's a link there to learn more about the Grow Life story here. So you can go through. There's also a button there to start a conversation with these guys. Why work at Grow Life? They've got a few reasons there. They talk about work-life balance, about development, about the culture in the practice itself. And then they've actually got more information, whether you're a doctor, a nurse, a medical receptionist, or allied health, they've got more information there, just enough as a teaser to get your interest. The rest of the practice gives you more information about the services and you know, the people and about and whatever else. But this is a really valuable page. And I'm hoping that you can see that having something like this is a lot more effective in your attractiveness to potential successes than the last two examples we just had a look at. But let's go a step further. Let's think even more, you know, outside the box, or give it a little bit more creativity. And to be honest, I struggled to find medical examples. This Grow Life one was probably one of the best that I found. But I did go to some other industries. So here's an example. Now, Hamilton Island, you don't have to try very hard with the photography to make it look and sound appealing. I'll give you that. But have a look in the top left there under the careers heading. Have a look at the content, and each of these links goes to a page with, you know, more information like what you're seeing on the screen now. And what I've done there is the page was too long, so I've wrapped it round and you can see it on the far right there. But they've got staff stories, they've got videos from people that work there which talk about what it's like and what they enjoy about being there and why they made the move. They've got information about what is it like to actually live here. And I would suggest to you that it's important to have information about, you know, what are the services like in your local area? Are we going to get high-speed internet? Are there schools for the kids? What if I need shops and supplies, and, you know, what's available, what's not? If I need to travel to see family interstate, how long is it going to take me to get to an airport? All these sorts of things come into that whole life sort of aspect. And then there's a bit there about reward, recognition, and development. That's an important aspect. You know, what sort of support am I going to get? What sort of development am I going to be able to access as I, you know, make this move? And then, you know, more information there for Whitsunday specific. Here's another example. This is a great example. This is from the Sunshine Coast. And as you just scroll down through the page that they have dedicated to coming to work in this environment, first of all, you know, they're talking it up, great workplace, amazing lifestyle, find out more, view profiles. They talk about the personal opportunities, how you can grow, how you can develop, the fact that the area is also an area that offers opportunities. They've got information about, you know, what they're hiring for. What would you like to know? There's information here, again, same sort of themes. They're exactly the same sorts of areas that we had early on in this presentation that are some of the key motivators. What are the people and culture like? What are the, you know, career opportunities? All these sorts of things. So look, this just gives you, I guess, a little bit of an example of the sort of thing that businesses are doing to attract people to come and work either in their area, in their business, in their organization. Now, even this, look, this website here is pretty impressive, right? But in reality, it's a bit of content writing, it's a handful of photos, it's a couple of videos. That's all it is. That's all it is. And that's something that really, it wouldn't be too hard to put together for your medical practice as well. So let's just
Jason,
keep...
just a comment there.
Yeah.
We started looking to attract doctors and staff to Biloela, we used the typical things of ads in the newspaper and Seek and what have you. We got no results at all. We put together a little brochure that had information about all the schools, how long it took to go to Brisbane, how long it took to go to Sydney, had some interviews with some local community people and what the community was wanting to support, people coming to their town. And it wasn't until we did that we had some responses to our ads and our thing, what we were doing. So, that speaks volumes to what you're suggesting.
Yeah, and look, this is exactly why I guess we wanted to spend a bit of time just presenting this content, because we've found it works. And we've found that a lot of people aren't doing this. And if they are, they're not doing it perhaps as well as they could. So I think this is where, look, the first part that Russell talked about was some of the structural side. What I've really gone through now is getting you to think about how attractive is your practice and why would someone choose to come. This last section here, which I'll actually burn through really quickly because we've got about 15 minutes left, and I'd actually like to use as much of that time for questions and conversation as possible. If you do have questions, just type them in the question box now. We'll see them as they come through. We can address them. But this last part is really, okay, so as Russell was alluding to, if we've got this information together, how do we actually get it out? How do we get the word out? How do we raise awareness? How do we get people to notice us? And certainly having flyers and being able to distribute those, as Russell was talking about, works. I would actually suggest there's a lot of things that can be done. The first thing I would say, the most cost-effective thing really to do is to keep this digital rather than printing resources and that sort of thing. So making sure that you have something on your website that talks to this, having resources, videos, examples, photos of the local area, the local town, links to maybe the local business hub or whatever it might be, can really go a long way. And then the way that we get that out, you may have heard of inbound, outbound marketing type things. Really, inbound is just drawing people in. Outbound is sort of more your advertising and push messaging. It's not complicated. But with your on the left-hand side of the screen there, things like making sure that your Google business profile is up to date, that you've got some great photos, that you've got good reviews of the practice. That goes a long way with patients and successes. Making sure that if someone does a Google search, you actually come up. And the information that comes up is something that is going to build attraction rather than detract from it. There are other types of sites, local business sites, government sites, recruitment sites. You can also look at partnerships with businesses in town, with trainers, with partnerships with colleges and associations and other groups, PHN, etc., that might actually be able to get the word out and get people seeing the information that you've put on your website to let them know just how amazing this opportunity is for them to come and work with you. Videos, blogs, etc. A lot of that stuff makes a huge difference in actually reaching people and engaging with them and raising awareness. And from an outbound point of view, Google Display, Meta ads and posting, that's Meta obviously owns Facebook and Instagram, so social media. LinkedIn, InMail is, we can get some pretty good results with that. And if you're not sure what that is, ask the question, we can explain that more. A lot of these people, our medical clients, well, they're all medical clients, so our clients are often surprised at the response you can get through digital engagement, through Google, through social, through LinkedIn, through those sorts of channels. But then I've also seen some really interesting things as well. So for example, when I get my news through apps, through the BBC ad, through the app, through the ABC app, I'm on news.com for all my trashy news, I'm on Sky News, and in the morning, in the evening, I flip through, I have a look at the highlights. And often on some of those news services like news.com, Google News, etc., you'll often see news stories which, yeah, they're news stories, but in reality, they're PR pieces that people have put out. So it might be a story about, healthcare services in your region, and it gives some information about the lifestyle benefits and other things as well. There are some interesting ways of actually, getting the word out. So look, I don't want to, like I said, I'm going to flick through the rest of the slides super quick. If you do want to get your website reviewed, just talk to us. You can, there is an audit tool available on our website if you want it. But we've talked about being found on Google searches. Here are some examples just of some flyers and emails and fax outs that we've sort of used for practices in the past. And this all comes down to making sure the messaging speaks to a need, or that it speaks to an attraction in the case that we're talking about here. Here's some messaging that we put together for Sunshine Coast Brain and Spine, which really was patient focused, but it was talking about the fact that they can stay in their local region rather than having to commute to Brisbane for procedures. There's similar sorts of messaging that we can talk about that's community based. You know, there's a lot that you can do with social ads as well as social posts these days. And I won't go through these case studies right now just for time's sake. But there are a few examples. And before we go on to the next steps, I guess we do just want to open it up if there are any questions or comments or any discussion.
Jason, I don't see any questions in the questions box. I have actually unmuted everybody, so you can actually unmute yourself now if you would like to ask a question at this point in time. No questions at this time.
Everyone's shell-shocked.
I suppose the big thing that I want everybody to realise is that you know, you might not believe that we understand what can happen or what your situation in your area is. And look, I can understand you thinking that, but what I suppose Jason and I have been doing all our lives is challenging the norm and really trying to look at things from a different perspective. You know, 30 years ago, I decided that I wanted to help people who needed heart surgery in developing countries, right? Children that were born with holes in their heart, children who had rheumatic heart disease, don't have the opportunity that we have in our country for life-saving surgery. And I came up with this idea of taking doctors and nurses to those countries, mainly because I was interested in traveling to developing countries and having some fun doing it. And then somebody told me I couldn't do it, it wouldn't happen. Well, 30 years later, we have done over 8,000 operations in 13 different countries. And it came by teasing out that vision, starting to look outside the square of what could happen, what could be done. And I suppose working in those countries has helped me even more in my own business in Australia, helping doctors meet a need and thinking outside the square and trying something new. And I really think that when I started my first medical practice, we actually had a formal plan, and every week we looked at where we were up to with that formal plan and what needed to be tweaked to get something happening. And so in lots of ways, we're asking you, what's your plan? What's your succession and retirement goals? You know, do you have it written down? Do you have a date as to when it's going to happen? We may not know. We've talked about all sorts of specialists and allied health and different people. We don't know what's in your town. But I think that if you started to have a look at it and say, is there a nutritionist in town that is maybe the wife of or the husband of somebody, and they're just looking for an opportunity to do something? Is there a physio or an exercise physiologist? Is there a, somebody, and how do we actually attract them to our practice? My feeling is that when you start looking and you start finding ways to talk to the community and get the community to give feedback, I actually found that I employed more staff in rural towns by putting a notice up on the community notice board than advertising. All right, and putting the message out there and everybody talking to their family and seeing who was there. But I really think that there are opportunities for you to achieve your succession plan, and what you're doing, you just need to start working on it and doing probably something different to what you've been doing for most of your life.
Hey, Russell, we have had a question come in.
Yeah.
Often commercial requirements of purchasers are in conflict with service culture values. Often commercial requirements of purchasers are in conflict with the service culture values of the practice. To increase your profit can mean increasing patient fees or reducing wages, equipment purchases. What are your thoughts on I guess that concern and how you can deal with that?
Look, I understand that loud and clear. I pride myself in being a clinician as a nurse, and but at the same time, when I became a business owner, I actually had to really work at how do I actually run a business that can pay the bills and the overhead and still maintain and meet the needs of the community, and that's really hard. I'm currently working with a number of doctors in Papua New Guinea who want to set up a state-of-the-art medical practice because there's lots of private medicine growing, but some people just are, doing stuff to make money, not providing good quality care. And there's people who can afford to pay, and there are people who can't afford to pay. And we're coming up with all sorts of ideas of how we can meet each person at each different socioeconomics level. And it's not easy, but it's really interesting when we start to talk to people about it. People come up with different ways of actually helping. We've got the doctors who are prepared to give to reduce their fees a certain percentage, but they need to charge something. We've got a group of philanthropic people who are prepared to contribute a budget, to go towards people who can't afford. And thankfully in Papua New Guinea, they have a thing called the One Talk system. So if they speak the same language, they will help their One Talk, their friend who speaks the same language. And so oftentimes families will get together to cover the cost of someone who needs to see the doctor or have special treatment or what have you. I'm not saying that's the solution, but I think we actually have to take all of those things. And you're right, it's not all about money. But if we don't run our businesses financially successfully, we're not going to be in business to help the people anyhow.
But I would add to that, I would say there's actually another side to this, because you're right, it needs to be commercially viable, but this actually raises the question of values. And I guess one of the big things, one of the reasons why Russell and I started working together was because we identified while we were working separately to each other that we shared common values. And that's something that's really important to both of us. And we've developed quite a network within the industry working with healthcare professionals, and values can make or break it. And we've seen it. I mean, Russell's talking about this practice we're working with in PNG, but Russell, there are so many examples I can think of just now of practices that we've worked with around Australia, where people have come together. They didn't really share common values. Sometimes they thought they did to begin with, but then as we've gone through the planning process, we've actually been able to tease out that there is quite a difference between their expectations for the business and what their values for patient care are and those sorts of things. And that is absolutely critical in attracting the right people. And I would go back to say that's where it is really important that you communicate the right values and the right attitudes and personality of your practice to make sure that you're attracting someone who's like-minded.
Yeah.
Jody, I see that you have your hand raised. You should be able to unmute yourself if you would like to ask a question of Russell and Jason. Perfect.
Thank you. Thanks. I couldn't find the chat function. I think it's a great idea in regard to updating the website and just putting some information out there that speaks to the culture of the practice and what would attract future people to come and work with you, or potentially future successors. I think in a rural area, though, there often aren't people that look to your area. You want to attract them to the area. So if we do that, and we already have a great practice that people would be interested in buying into, how do we tap into, what do you have any evidence in regard to whether advertising in medical journals or social media, or the different avenues for finding those people who might like a rural or a sea change, and finding them and drawing them to your website?
So, well, I can talk to the digital advertising opportunity, and this is something that we've had. Well, just because of the environment, I guess in the last few years, through COVID, we had a lot less overseas doctors coming through. COVID meant that healthcare professionals were working a lot harder, and a lot of them were burning out. We've got record unemployment rates at the moment. Like, all of these things have just created this perfect storm where it's really hard to A, get people, B, get the right people, and C, as you're saying, actually be able to reach and communicate with the right people. So one of the things that I love about digital marketing is just how targeted it can be. If a campaign is set up right, no matter what platform we choose to use, whether it's through search engines like Google search, or whether it's through social media, or whatever it might be. If somebody does, I mean, we joke around about, be careful what you say, around your mobile phone, because Google's going to hear it and you'll start getting ads for whatever you've been talking about. And you've probably experienced that. You've done a search for, I don't know, a new bed at home or something, and all of a sudden you just start seeing all these ads or news stories or information about beds. What we can do in terms of targeting is actually quite scary these days, and it's been like that for years. It's just getting more and more developed. It's really data driven, and with the, I guess, growing, or the emergence and the growing use of AI, it's only getting more targeted. So there are tools and techniques that we can use to provide really targeted messaging through those channels. And then you've got things like InMail and Sales Navigator on LinkedIn, and a lot of other tools where you can actually search for people that have expressed interest in certain areas, or perhaps joining a practice and those sorts of things. So there's some of the digital methods. Russell, did you want to talk to any others? I know we've used a few other methods as well.
One of the things that we did, I think that digital marketing is just amazing what you can accomplish with it. So I won't, and you've talked about it, I won't spend any more time on that, but I think putting together a story and pictures and videos, so that it's a digital story that you can send out, is really, really important. And then if you can link that to your website, what have you, so that come and get a story. We started to actually, when we put our little brochure together about Biloela, we actually sent it out to some organisations in the UK and some of the medical associations in the UK, and got some interest from there. We ended up getting people locally. We also made a real point of trying to target people within the rural and remote training programs, because those people were doing that training because they wanted to live in the area, and what they were looking for was the right place to work, the place that had the attractive bits that filled all the things that they actually wanted. And one of the things that we found was, is my spouse going to have a job? And so going to the community and getting the community to commit to finding jobs for the spouse of the doctor or the physio or the nurse was really, really important to do. So I think there's a whole gamut of things And if we develop something digitally that we can use on your website, we can then use it with digital marketing.
And I guess the opportunities for spreading the message through different digital platforms. I mean, you alluded to publications through association, college newsletters, through industry, online newsletters, publications, magazines, etc. There are a lot of opportunities there. Some of them are more shotgun, some of them are more targeted. But you can actually get fairly decent results. Look, I'll be frank, it has been difficult more recently, like there's no doubt.
Yeah. One of our dreams with our Docio product is to actually create an ecosystem for healthcare where there's members around Australia, around the world, that we can actually get in touch and share people's stories, whether it be people looking for staff, whether it be people looking to sell their business, and try and be able to marry. I think that there are ways to do it now, but I think in the future we'll find more and more venues that can promote this and make it a lot simpler.
All right, folks, we have come to the end of our time for this evening. Thank you so much, Jason and Russell, for sharing your wealth of expertise and knowledge with us. That was really fantastic. There were no more questions in the questions box. You do still have an opportunity though, if you have more questions. I know Jason and Russell both mentioned when you do the evaluation, there's an opportunity to put some questions in there, and they are happy to send a response through for those questions. But thank you very much for joining us this evening. It was an absolute pleasure. I'd like to say good evening to everybody and please have a very good night. Thank you very much.
Not all.